Good evening and thank you for joining us for KREM 2 News at 6 tonight. I'm Mark Hanrahan.
And I'm Whitney Ward. We begin tonight with that breaking news. Hoopfest 2021 has officially been canceled. The move coming as the region is just dealing with surging COVID cases and hospitalizations.
And that cancellation comes just 2.5 weeks before the world's largest 3-on-3 tournament was set to take place in downtown Spokane. KREM 2 Sports Director Brenna Green joining us live on the set here tonight. And Brenna, not exactly a surprise, maybe still just a huge blow though for the entire region, really.
Yeah, this is a very sad and crushing day for our community. Hoopfest is so important to Spokane, and not having it for a second year is just very difficult. Hoopfest says this decision was made in the last 48 hours as our hospitals continue to become more and more crowded with COVID-19 patients, and that it would just not be the responsible thing to do to host this event right now. This means when the next Hoopfest happens, if it happens, which is sadly what we have to say now, it will happen on June 25th and 26th in 2022. We will go 3 years without a Hoopfest. MultiCare is a partner of Hoopfest. Here is what MultiCare Rockwood Clinic President and COO Alex Jackson said in a statement. The latest surge of the Delta variant has our healthcare facilities overwhelmed. Bringing together thousands of people possesses a risk and will be detrimental to our efforts in caring for our community. We are grateful to partner with these groups in advocating for healing and a healthy future.
So we know that a lot of people probably have a lot of questions at this point. So this is what we know if you are currently registered for Hoopfest. Registered teams have a choice now between donating their registration fees that they've already paid or requesting a partial 20% refund. Now, according to Matt Santangelo, the reason for that partial refund is simple. It's because the decision to cancel didn't happen until today. So team captains will be receiving an email now to determine whether they're going to just donate that fee to Hoopfest or request a refund. So the requested refunds will be processed, we're told, by September 30th. What teams will still be receiving includes that Hoopfest 2021 official player t-shirt, and the team captains will also still receive that Hoopfest basketball.
All right, now we will turn our attention to the man in charge of Hoopfest, Matt Santangelo.
Yes, he is joining us now live. First of all, Matt, thank you very much for your time. We certainly appreciate it. We know that this was not an easy day. If you could just kind of talk me through the last couple of days when you kind of realized that canceling Hoopfest was going to have to be an option, that the COVID situation just was not improving.
Yeah, I think for us, I mean, 48 hours ago, we were a go. And then just this morning, as we continue these conversations with, regional health professionals, even at the state level, we realized that it was no longer a go. The health system is so overwhelmed right now with cases, with beds being full, and that's regional. And obviously leaks into Idaho as well. That it just no longer safe to have a Hoopfest. And that is a really, really tough spot to be in for us. But ultimately, it led to the decision we made today.
Matt, Brenna Green here. Just how are you feeling right now? Hoopfest is your baby, and year two without having the big event in Spokane.
It hurts my heart. My heart is hurt, is how I feel, because you feel like you let so many people down. Hoopfest is such a treasure. It's such a gem for the region, from basketball playing, from a connection and love from the volunteers, from the support of sponsors, and ultimately like the economic impact to the region. It has such a great and far-reaching impact that my heart hurts that we were unable to do it. But at the end of the day, you're doing the right thing. I'm not a health professional, so I have to listen to the health professionals, and I have to be, willing to be open to their guidance and suggestions. And ultimately, that's what led us to this decision. But it doesn't make the decision any easier. It is hard, and my heart's really heavy at the moment.
Hey, Matt, Mark here. A quick question. We've heard from several venues or events that are now requiring proof of vaccination to attend a concert, perhaps. Was that ever taken into consideration for Hoopfest? Hey, if you want to play or be on the court or around the court, you have to prove your vaccination? Yes. We considered that. We considered negative testing. And we just found it to be kind of logistically too challenging. We're an open environment event. We're multi-day, and we're a team-based event. So this isn't just you and I going to a concert and proving one way or the other. This is, what happens if I'm one way and you're another way, but we're teammates? How does that impact
our team being able to participate. And then how do we interact with fans and volunteers as well? So logistically, we were aware of that. We considered all those things, but we're a different type of event than a concert or even a normal sporting event where it's a ticketed event. And ultimately, we decided that was not able to be those measures weren't able to be taken so quickly with just 2 weeks left for the event.
Matt, you have already said that if people want to get a refund, it will be a 20% refund. And I know you said that a lot of that was simply because you've incurred a lot of expenses already. What does this mean financially just to the whole organization not to be able to have this now for the second year?
I really, really appreciate that question because first and foremost, the majority of people understand. They understand that what's going on from a financial burden for just a small nonprofit in our community, which is what we are. But for those people that are more upset about what that refund policy is, I want to say, we hear you. I completely understand where frustration would come in as well. And so I think, for us, even with the 20% refund policy in place, and, for those teams that ultimately decide to request a refund, it still puts us on shaky ground as a small business that did not have its primary business activity available to us for 2 years. And so that really is the reason behind the refund policy, is because not only have we not had the ability to have our own event, but also the amount of expense that we've incurred in planning for 2 weeks from now for Hoopfest 2021. And so we hear you. We hear the complaints. We hear the frustration from teams that have registered. But up until this morning, we were planning for our event, and we're going to work with those teams to really try to mend those relationships, because it's not just about Hoopfest this year. It's about Hoopfest for many years to come.
All right, Matt Santangelo with Hoopfest, thank you so much for your time. And my goodness, let's hope we can have Hoopfest 2022, right? Thank you very much.
Well, the mayor of Spokane, Nadine Woodward, also recently came out with a statement about the cancellation, saying this is an incredibly tough, agonizing decision for Hoopfest that puts the needs of youth first. She said, "We're disappointed for the athletes, volunteers, organization, and community that the pandemic has disrupted another community institution." But then she went on to say Spokane is resilient and will wrap itself around Hoopfest as it rallies and begins planning for an even better return.
The cancellation means a huge loss in revenue, as we just heard, for the entire region, really, and it means thousands of players who'd registered and paid to compete will now have to change their plans.
KREM 2's Ian Smay actually spoke with one of those players, and he is joining us now live at the Hoopfest court in Riverfront Park with what he had to say. Ian.
Mark, Whitney, I am here at the Hooptown USA court in Riverfront Park, and this was set to be the first Hoopfest since the court's completion, but that will not be happening now because, as you said, Hoopfest announced to be canceled again this year just a few hours ago. And that means that for players that play year in and year out, they'll have to wait another year to get back on the court. One of those players is Kevin Coons. He is a Spokane native and lifelong Hoopfest player. We caught up with him this afternoon here at the Hoopfest USA court in Riverfront Park. He says that while it's difficult to have the tournament canceled again, he's hopeful for the future.
Not playing Hoopfest again is difficult, but again, what's beautiful about the work that Hooptown has done is these courts are providing an opportunity for us to play every day, not just one weekend, and to know that Hoopfest will always be there. So if it's not this year, that 2022 will look bright for Hoopfest and Hooptown.
The Hooptown USA court is one of 30 the Hoopfest Foundation has built for community use. The Hoopfest Foundation has also donated more than $2.5 million to local charities in the last 30 years. Hoopfest now joins Pig Out in the Park on the list of large events in the Spokane area to be canceled due to this current COVID-19 case spike. And as you said earlier, teams can either choose to donate their entry fee to the Hoopfest Foundation or get a 20% refund. Reporting in Riverfront Park, Ian Smay, KREM KREM 2 News.
Ian, thank you very much. And we know that this is a lot of information. You may still have questions or maybe didn't hear all of the broadcasts that we've had so far. So for the latest on Hoopfest being canceled and the refund policy and what this all means, just text Hoopfest to 509-448-2000.
Of course, the cancellation comes as coronavirus cases continue to surge all across in the Northwest, including in North Idaho. The current surge there has set a record. 96 people are currently hospitalized with COVID just at Kootenai Health alone.
Yeah, it is forcing the hospitals now to take some drastic action. Our Casey Decker is live at Kootenai Health tonight with exactly what they're doing there. Casey?
Yeah, Whitney, Mark, what they're doing is basically turning a building that is not meant to treat patients into a sort of overflow COVID wing of the hospital. This building here, it's basically an office building. This is home to usually classrooms and conference rooms, but right now it is home to 22 COVID beds. The Delta variant of the coronavirus isn't just more transmissible, it's also more dangerous and deadly.
Even the healthy, younger, no comorbidity patients, we're seeing those become sick enough to become hospitalized. In fact, in just this last week, in a 36-hour period, we had 3 patients under age 45 die who did not have comorbidities.
Hospitalizations are skyrocketing. Kootenai Health currently has 96 COVID patients, 34 in critical care. That surpasses the previous record of 91. And furthermore, that record was achieved during a wave that took a few months to peak. The current number was reached in a matter of weeks and with no end in sight. And Kootenai Health's chief physician, Dr. Karen Cabell, says even though the data doesn't reflect it right now, the death toll from this wave will be high.
We're seeing a very high mortality rate as well. But the reality is that most of these patients that come in, they're often in the hospital 2, 3, 4, 5 weeks before they die. And so we're just at the very beginning stages.
On top of the low capacity, they're also low on staff.
Many of the frontline nurses and physicians that are helping care for these patients are working very long hours and doing a lot of overtime. The team is very tired.
That means the entire hospital is stretched thin.
We have many patients that need services for things like car accidents, other types of infections, other health issues, and we're really struggling to find capacity for them because at this point, half of our baseline bed capacity is being devoted to COVID.
The first step to dealing with this surge was doubling up patients in existing COVID units. But every day there are way more admissions than there are discharges. So now they're taking the second step and creating a makeshift COVID wing out of an office building on site.
This is a space that we fit up for 22 beds. The rest of this space will vacate because you don't want to commingle different types of occupants.
What was classrooms and conference rooms is now clinical space. Carpets were ripped up, rental beds brought in. They even had to purchase hand washing stations because the rooms don't have enough sinks. There are no patients here yet, but hospital leaders are already preparing for what they might have to do if this space also fills up.
Beyond that, we'll continue to explore whether we need to do other field hospitals, buildings, tents, or how we may access additional beds throughout the community and the other hospitals.
And an important point here, nearly all of the hospitalized patients are unvaccinated, and the few who were vaccinated, I'm told they had various sorts of immune system issues that caused the vaccine to be less effective for them in particular. Reporting live in Coeur d'Alene tonight, Casey Decker, KREM 2 News.
Casey, my goodness, some striking images, right, of the hand washing stations, the portable hand washing stations?
In the conference room.
Wow, all right. Well, and with the surge of COVID patients, Kootenai Health now preparing to transition to what is called crisis standards of care.
Yeah, that means that there is a possibility that not every patient will get the top level of care they need. So the state coronavirus task force is the only one with the authority to authorize crisis standards of care. And it's never happened before throughout this entire pandemic in Idaho or in Washington. So that should give you some sort of indication of just how severe the situation really is in North Idaho right now. This is intended to only be when hospitals are so overwhelmed by patients and resources are so scarce, it's no longer even possible to provide every patient with the level of care they would normally receive in normal circumstances. The goal is just to extend care to as many patients as possible and save as many lives as possible, knowing that not everyone can be saved. Now, last winter during the previous COVID spike, Idaho Governor Brad Little gave some specific examples of what Idahoans could expect under the activation of crisis standards of care.
He said, for example, if your son or daughter gets in a car crash, a hospital bed may not be available, or they could get care in a repurposed conference room. If your wife is diabetic and gets an infection, she may not get a hospital bed. If your husband has a stroke or heart attack, it may take longer for paramedics to arrive. Again, only the state has the authority to issue the Crisis Standards of Care Declaration. It can be declared for a specific region or for the entire state. And while hospitals are struggling to keep up with the number of COVID patients coming through their doors, some patients are protesting masks in schools tonight. When we come back, we'll take you to the mask protest happening outside Spokane Public Schools board meeting tonight.